This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, August 19th, and I'm Zach Caruso. Our lead story this week is from BMC Primary Care titled Association Between Housing Status and Mental Health and Substance Use Severity Among Individuals with Opioid Use Disorder and Co-occurring Depression and/or PTSD. This is a cross-sectional analysis of associations between housing status and mental health and substance use severity among primary care patients with co-occurring disorders. The study is a sub-analysis using data from the Collaboration Leading to Addiction Treatment and Recovery from Other Stresses randomized control trial, which tested the collaborative care model for primary care patients with OUD and co-occurring depression and/or PTSD. Of 797 patients in the study, 13% were currently unhoused, 24% were unstably housed, and 63% were stably housed. Those who were unhoused were on average younger and had not used prescribed MOUD in the past 30 days. The analysis found that being unhoused or unstably housed was significantly associated with higher PTSD symptom severity, depression symptom severity, opioid use severity, and opioid overdose risk behaviors compared to those who were stably housed. Next is an article in Harm Reduction Journal titled Evaluation of Nitazene Immunoassay Test Strips for Rapid In Situ Detection of Nitazene and Nitazene Analogs in Illicit Drug Samples. Nitazenes, a group of synthetic opioids, have been more commonly identified in the drug supply and can contribute to overdose deaths. Researchers in this study evaluated a commercially available nitazene test strip, testing it against 36 nitazene compounds and 93 other drugs and adulterants. The test strips appropriately detected 28 of the 36 nitazene compounds, but failed to detect 8. In addition, there was significant variability in the lower limit of detection across the various nitazene compounds that were detected. Authors note that while test strips may assist with harm reduction, validation testing is needed and limitations and risk need to be clearly communicated. Next is a study in JAMA and is titled Hospital-Based Methadone and Buprenorphine Initiation Practices by Addiction Consult Services. This national cross-sectional survey of 58 Addiction Fellowship-associated hospital consult service directors seeks to outline the novel methadone and buprenorphine initiation practices being utilized to address high-potency synthetic opioid use. The survey found that the majority of consult services were utilizing rapid methadone initiation, defined as more rapid than the standard of 40 milligrams on day 1 with an up titration of 5 to 10 milligrams every 3 days, with 67% reporting using a rapid methadone initiation protocol for more than half of patients. 93% of respondents stated that they had changed buprenorphine initiation practices due to high-potency synthetic opioids. 92% of services offered low-dose initiation, 87% offered traditional initiation, and 75% offered high-dose initiation. The survey findings suggest that hospital addiction consult service practices are adapting to a changing opioid supply, potentially outpacing research and clinical guidelines. Our next article is in JAMA Network and is titled Alkyl Nitrite or Poppers Exposures in the U.S. Alkyl nitrates, or poppers, are drugs that are commonly used for their short-acting vasodilatory properties and purported ability to enhance sexual intercourse. Whereas inhalation is the typical route of administration, ingestion has recently become more common, possibly because of packaging that closely resembles energy shop beverage products. Poppers use can cause methemoglobinemia, a potentially life-threatening condition characterized by impaired ability of hemoglobin to carry oxygen to tissues. This case series study analyzed poison center reports during an 11-year period and found a disproportionate increase in severe clinical outcomes among patients who reported ingestion. Prevention and harm reduction efforts are needed for those who use poppers. Next is a study in the American Journal of Addictions titled Distinct Oral Microbiomes in Individuals with Tobacco Smoking Compared to Non-Smoking Healthy Individuals. Chronic tobacco smoking contributes to oral health problems such as periodontitis and tooth decay, which can result from smoking-altered oral microbiomes. This cross-sectional study compared the oral salivary microbiomes of 20 chronic tobacco smokers and 23 non-smoking controls, all of whom were Chinese males, using microbial 16S rRNA sequencing. The duration of smoking, age, and information on gingivitis were collected and analyzed using the non-parametric Mann-Whitney test and regression model. After adjusting for age, gingivitis, smoking duration, and FDR, only the abundance of the Pectinitis genus and Streptococcus australis species was significantly increased in smokers compared to controls. Maintaining good oral hygiene, using oral probiotics that reduce pro-inflammatory microbiomes, or treating oral diseases may help prevent the pathogenesis of tobacco-enriched commensal pathobians. Our final article is in JSAT and is titled, Why is Substance Use Missing from My Patient's Problem List? CTN Research to Advance Screening, Prevention, and Treatment of Substance Use in Primary Care. While only about 20% of Americans with an SUD receive treatment in addiction treatment programs, the majority will have had primary care visits within the last year. The authors in this commentary review studies by the Clinical Trials Network focused on primary care settings, including studies focused on screening tools and treatment interventions. The authors identify 3 areas of focus needed in future research. 1. Treatment interventions for polysubstance use. 2. Improved screening and treatment for cannabis use. And 3. Interventions for unhealthy substance use for those not seeking SUD treatment. Authors also note future research needs to address implementation as well as effectiveness. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.